The following segment is sponsored by Oakview-Medical-Associates.
Getting a case of the sniffles is not what it used to be. With everyone concerned about coronavirus, any minor cold symptoms could have you questioning whether it's okay to leave your house. Dr. Anita Oakview from Oakview Medical Associates is here. Hi, Dr. Anita.
Hey, how are you?
Well, let's jump into this. Today's reaction to what used to be kind of a common cold symptom. What are you seeing at your practice? More people must be coming in concerned about worst case scenario every time they get the sniffles, right?
Yeah, what we're seeing, in the setting of this pandemic is we can't just think a common cold or sniffle is just an allergy or just a common cold virus. We don't really know the impact of the SARS-CoV-2 virus in terms of symptomatology. We have patients, that come in with sinus headache, just some nasal stuffiness, and they're positive for the virus, and others that are really sick with fever, cough, shortness of breath that also test positive. So I think in the setting of what's going on with our kids resuming school, we really need to be mindful with our family, making sure that we check on our kids and our spouses every day. If there's any fever or just feeling blah, feeling down, bringing it to the attention of your primary care physician, I think is the first step. Mm-hmm. Also, because now, allergy season is around, ragweed, you may have a nasal stuffiness that's going on for a few days and you're not quite sure. Just check in, call your family physician. We are trained we know you, we know your health history, so we're good at identifying if you need to give that more attention. The best thing would be to stay home first, I think, and then have a game plan of how to address that. I think that's important.
Okay, so and I think I know what you're going to say is you call the doctor, but what should not be the determining factors for deciding whether you should stay home from school or stay home from work? What's your checklist?
That's a great question. So my checklist is basically, if there's a fever, make sure you all have thermometers at home. If there's a fever, if there's a cough, shortness of breath, any chest congestion, and then also looking out for atypical symptoms with COVID-19, which are fatigue, muscle aches, headache, nausea, vomiting, diarrhea, a new loss of taste or smell. Those are some of the things. Of course, if you are significantly sick, that's when you call 911, get that emergency attention. Anything that's out of the ordinary, or if you've been possibly exposed to somebody, just knowing that needs to be given some more attention.
Absolutely. Well, talk to us a little bit about Oakview Medical Associates. Tell us what makes your practice special, and we want to know more about your approach to treating patients.
Absolutely. I think as a primary care practice, I really created our practice with the foundation of treating the patient not reactively, but proactively, having a good frame set or mindset of preventive health. We see patients from all walks of life for all kinds of conditions. We see newborns to 100 plus years of age. So we are trained in really identifying where you are in your health and getting you well, getting you on a path of wellness. We have X-ray in our office, we have diagnostic ultrasounds, we have a lot of facility equipment available if we need to do that. But then I'm board certified in lifestyle and obesity medicine, so my approach is always listening to the patient, looking at it in the context of their history, seeing what's brought them there. Talk to us about your concerns, that's what we're here for, and we do it in a very systematic approach, integrating everything together. Some patients have a more holistic mindset. They don't want to do too many medications, and others realize the value of prescriptive medicine along with lifestyle medicine. So we're here to guide that whole process. Mm-hmm. And it's been really fun. I wake up every day just loving the fact that I can see people, talk to others, and we've created that culture in our office. So we welcome people we're accepting new patients.
Yep. And your passion for what you do comes across every time we talk to you, and you're always so reassuring. Anything that you want people to keep in mind in these days where, being sure is not always happening. People are a little bit nervous.
Yeah, there's a lot of anxiety. We're seeing a lot of uncertainty, stressors. So the first thing is actually talking to your provider or physician, because we will be able to help identify, is this something that needs more attention, or is this something that we're going to learn to have to improve our mindset? I never say never. Just because you've been told that you have a condition and that's the way it's going to be. I've helped patients reverse diabetes, get into the best shape of their life, lose 50 to 100 pounds that they never thought was possible because they were told it was their hormones. I don't think you can really, person's health is a very dynamic, fluid state. You can always, with the power of positive thinking, power of good nutrition, lifestyle medicine, we can always empower others to change. And I live that myself as a mom, as a wife, as a professional with a practice. I think learning to communicate, and community is a big thing. When you come to our practice, you feel a sense of community. You're not alone. We share stories. We've had group visits until this whole pandemic, and we're probably going to resume online through some of the virtual access. But I think just knowing that the first step towards getting better and improving your health is taking charge of your health, and then making that first call, that talking to your physician will get you on that path of wellness. I always believe that strongly.
Fantastic. And people will love working with you. They can contact you. Oakview Medical Associates is located at 11 Five Forks Plaza Court in Simpsonville. The number 627-0444. Dr. Anita, Oakview Medical Associates, thanks so much for talking to us.
Thank you. Take care.